Hello, I'm Nathan Groathouse, Director of Marketing and Development for SummitStone Health Partners. It is my honor to welcome you to this year's annual Fall Fundraiser. Over the last few years, it has been my privilege to provide opening remarks for our annual breakfast fundraiser. Unfortunately, COVID has changed all of that. And this year, we have gone virtual. And so, I would like to go over a few housekeeping items associated with our new platform before we get started with the program. First, you may have noticed that your video and audio capabilities have been disabled. This is to allow us to present all the great information that we have to share in the short amount of time that we have together today. If you do have thoughts or questions along the way, then I invite you to use your chat function in your Zoom window. Also, if during or after today's presentation you would like to support SummitStone with a donation, we have several options for you. You can donate on our website at www.summitstonehealth.org/fundraiser and click on the green Donate Now button. Or you can send a check to SummitStone Health Partners and mail to 4856 Innovation Drive, Fort Collins, Colorado 80525. Please be sure to note that it is a donation. Thank you all again so much for joining us today, and please enjoy our program. Without further ado, it is now my privilege to introduce our CEO, Michael Allen.
Hi everyone, my name is Michael Allen, and I'm the CEO for SummitStone Health Partners. Thank you so much for joining us today for this very special fall fundraiser. I appreciate your attendance, particularly since this is now a virtual event. I wish we could be together in person, sharing a meal, and I could shake your hand and maybe give you a hug. Remember those days? So much has changed so quickly. However, I'm grateful for the technology that allows us to at least connect in this way. Today it will be my privilege to spotlight for you some of the many compassionate, life-saving treatments and services that our dedicated SummitStone staff are providing every day for our community. I'd like to walk you through some of the challenges we'll be facing in the coming months, and also share some of the unique and innovative programs that we're developing with our community partners to combat these challenges. But before we dive into the program for today, I want to be sure to thank our presenting sponsors, UC Health, who is a critical partner in providing leading-edge healthcare for our community, as well as Roche Constructors, whose expertise helps us develop state-of-the-art buildings, allowing us to provide facilities where people can heal and recover. Your partnership and support of our mission is invaluable, so thank you again, and thank you to all of our sponsors. We have and will continue to accomplish so much good together for our community. I would also like to recognize the wonderful members of SummitStone's Board of Directors. These community volunteers devote countless hours in meetings, advocacy, strategy, advice, and support. SummitStone is a better organization because of their efforts. Please join me in thanking them for their work. It goes without saying that this year has been unlike any other we have experienced before or can even remember. 2020 is truly unprecedented in modern times, from unexpected economic challenges to heightened awareness of inequality and systemic racism, from ongoing opioid and suicide epidemics to major wildfires, and of course, there has been COVID-19. Our country, our state, and our communities are facing challenges we have never faced before, and certainly not all at once. The toll on our lives has been steep so far, and the lasting impact on our mental and behavioral health is still to be determined. Now more than ever, we need to work together to confront these challenges by emphasizing the need for community mental health, embracing community partnerships, and seeking innovative, impactful solutions. In March of 2020, a highly contagious virus changed the world as we knew it. We would no longer be able to interact with each other as we once had. We would fundamentally change the way we went to work, how we accessed education, how we went to the dentist, the bank, the grocery store, and of course, how we socialized. Months later, there is still so much uncertainty as to how it will continue to affect us. However, through this dramatic change, I am so proud of how SummitStone staff responded to the COVID crisis. At SummitStone, we scrambled to bring our best minds together to ensure that our services would continue to support our community. SummitStone was one of the first healthcare providers to move our face-to-face, in-person services to virtual through telehealth. In fact, we were amazingly able to offer our outpatient services at 80% virtual by March 18th and 100% virtual on March 20th, becoming fully remote in just 3 days. With strategy and urgency, leadership from SummitStone and the Health District of Northern Larimer County quickly organized our community's behavioral health providers to coordinate care and to develop a communication plan, helping to explain what services were open and available through what methods. Through all of this, SummitStone continued to welcome those in need of our services. While many staff went virtual, our frontline staff continued their work face-to-face through this pandemic. SummitStone Crisis Services remained open for behavioral health urgent care, mobile response, and crisis stabilization. We continued working with our first responder and law enforcement co-responders, jail-based care, judicial systems, intensive treatment for our hospitals, our Spirit Crossing Clubhouse, families with early childhood needs, and of course, community-based care, all bringing behavioral health clinicians to the locations where we are most needed. These people are truly healthcare heroes. Can you please join me in thanking all SummitStone staff and especially our frontline workers? This pandemic has taught us all a lot of things. As the CEO of this amazing team, I couldn't be more proud of how our employees stepped up and embraced the changes we had to make so quickly. I saw decisiveness, leadership, and alignment. As an organization, together, we learned that we could be nimble, roll with the punches, and move more quickly than we ever thought possible. Wow, that is a lot. But as awesome as SummitStone staff are, we certainly couldn't have done it alone. I would like to take a moment to highlight some of our key partnerships from this past year. First, Larimer County. We would not be able to have the breadth of reach with the services we provide to our communities if it weren't for the full support and resources provided by our relationship with Larimer County. Please stay tuned because we have some special guests coming up. We'll talk a bit more about this key partnership. Our co-responder program has made remarkable inroads, collaborating with law enforcement and first responders to reduce incarceration and hospitalization of people who interact with those agencies due to their behavioral health issues. We are so grateful to our co-responder partners, Loveland Police Department, Larimer County Sheriff's Office, Thompson Valley EMS, and Estes Park Police Department. Utilizing the already well-established Connections Hotline, the Health District of Northern Larimer County has provided us with a platform for our efforts with the FEMA Emergency Response Grant, known as Colorado Spirit. This program has made it possible for folks impacted by the pandemic to call for emotional support and community resources anytime, day or night, 24/7, when dealing with the hardships caused by COVID-19. Because of this relationship, SummitStone's Colorado Spirit programming is already up and running and serving our community far ahead of other similar programs around the state. UC Health is an important partner in providing a continuum of behavioral health to our community, and we are so excited for the opportunity to collaborate on developing state-of-the-art behavioral health triage, assessment, and treatment in the new county BHS facility. Two programs and collaborations that I would also like to highlight are the Colorado Opioid Synergy, Larimer and Weld, or COSLA, and NOCO Cares. SummitStone is one of the partners working with the Northern Colorado Health Alliance, implementing a federal grant, and we are now starting our third year of funding. Through this grant, the collaboration team developed a hub-and-spoke model which centers around a comprehensive care coordination team, working to connect people experiencing addiction issues with substance use disorder providers throughout Larimer and Weld counties. To date, the team has helped more than 400 people access services. NOCO Cares is a collaboration of more than 40 community partners from a wide array of organizations committed to working to expand treatment and prevention of substance use disorders. In response to community need, the NOCO Cares Coalition recently expanded its focus from exclusively opioid use disorder to a broader scope including all forms of substance use. Additionally, the COSLA team facilitates a bi-monthly family support group for those with loved ones struggling with addictions. This virtual platform has provided ongoing support to families despite COVID quarantine restrictions. The team continues to be actively involved with medication-assisted treatment services in the local emergency departments and is embedded within the Larimer County Jail. These services focus on the successful transition and warm handoff post-release or discharge for those vulnerable populations. Because of this coalition work, Larimer County and Northern Colorado is leading at the state and national level in our response to addictions, particularly opioid use. Recently, SummitStone took leadership of a local initiative called Naloxone Champions. Naloxone is a life-saving medication that is given in the event of opioid overdose. With no need for advanced training to use it and minimal side effects, Naloxone has become a crucial tool to help save lives during this opioid pandemic. The Naloxone Champions program has become pivotal in advancing the availability and use of naloxone in our community. Recently, in conjunction with the Northern Colorado Health Alliance, through a Colorado Department of Public Health and Environment opioid response grant, Naloxone Champions held a highly successful overdose awareness film series focused on community engagement. This brought the message to Johnstown, Loveland, Fort Collins, Greeley, and Estes Park. The event culminated with an intimate in-person gathering on Overdose Awareness Day in Estes Park. Nearly 400 people attended and more than 150 naloxone kits were distributed. The group is now focusing on placing naloxone vending machines in Loveland, Greeley, and Fort Collins to provide naloxone and other necessary items for urgent situations and for continued preventative services. In addition, the team is rolling out the naloxone mailing program to ensure naloxone is distributed via mail free of charge to those in our rural communities. Finally, the team is in process of hiring 2 persons with lived experience to embed within the team to offer a unique and invaluable perspective on our work moving forward and to be an additional resource for those seeking treatment. Now, looking ahead, I would like to take this opportunity to mention a couple of our new programs that will be serving Northern Colorado in the coming months. First, I'm extremely excited to announce a true milestone for us at SummitStone and for our entire community. Opening in December 2020, we will be launching Garcia House, SummitStone's newest residential treatment program. Garcia House is named after one of our community's most stalwart substance use treatment champions and a true advocate for diversity, equity, and inclusion, Fred Garcia. Garcia House is one of only 3 unique circle programs in the state, programs which provide residential treatment for up to 16 people who are experiencing severe and complex mental health and substance use issues. Opening Garcia House brings us one step closer to achieving the grand vision of being able to provide a full continuum of care for mental health and addiction services within Northern Colorado. But I don't want to ruin the show with a spoiler, so please stay with us for an exclusive first look inside Garcia House and a very special message and interview with Fred Garcia. Additionally, we are very enthusiastic about our partnership with Larimer County and UC Health to bring a new behavioral health services facility to our community. This should be operational in the fall of 2022. The facility and its associated services, which was approved by taxpayers in 2018, will fill critical gaps in behavioral health care and will provide much-needed treatment supports and resources to our community for decades to come. Please stay tuned for a special presentation about this exciting project. While I have been anxiously looking forward to sharing all this information about our wonderful projects and partnerships over this past year, I could not close my remarks without commenting on the current economic crisis. As you probably know, the state of Colorado has already cut over $3 billion from the current year budget. Down to the bone, as I heard one legislator say, and while SummitStone has so far weathered this year's financial storm pretty well, the state budget is predicted to be cut another $2.5 billion next year, with another $1 billion cut in fiscal year 22. This is why we are holding our fundraiser today and asking for your help in supporting our substance use disorder services. We appreciate your generosity. Thank you. And thank you again for being here. I am so grateful to you for joining us during this virtual event, and I can't wait to see you in person soon. So with that, I would like to introduce Laurie Stolen and Leslie Brooks, who are also behavioral healthcare heroes. Thanks to them. And again, thanks to all of you for your support.
I'm Laurie Stolen, Director of Larimer County Behavioral Health Services. We administer the 2018 voter-approved sales tax, which is dedicated to expanding and enhancing behavioral health services across Larimer County. There are 3 funding pathways that tax revenues are redistributed back to the community. The first is our Impact Fund, which is our annual grant program. In 2019, we awarded $1 million in grants to 29 different agencies. In this year, we will award $2.5 million to 34 agencies around Larimer County. The next funding pathway is the Crisis Services Facility, currently under design and planned to open in mid-2022. Lastly, we have the Bridge Fund, which is intended to assist in removing the barriers people experience in accessing care. We are so blessed to live in a community that is willing to prioritize social and emotional well-being. Through uncommon partnerships, we create stronger outcomes for those we serve. In the midst of the current chaos and uncertainty we are living, we also can find great opportunity. Only by adopting and maintaining a collaborative and integrative approach can we overcome the profound challenges we face in addressing the critical gaps in behavioral health care. With 1 out of every 5 residents, which in Larimer County equates to 70,000 people who are challenged with either a mental illness or substance use disorder, and with someone dying by suicide every 5 days, the time is now to push ourselves to rethink how we address these illnesses. As Helen Keller is so well known for saying, "Alone we can do so little, together we can do so much." Larimer County is fortunate to have SummitStone Health Partners and UC Health as the chosen providers of services in the new behavioral health facility. We have jointly committed to contributing as the catalyst of change, of researching emerging solutions, and maintaining a focus on flexibility and innovation in order to improve the outcomes for those we serve. As we look to our collective future, we are optimistic and remain loyal partners in transforming the behavioral health landscape of Larimer County.
My name is Leslie Brooks, and I am a family and addiction medicine physician. I serve as the BHS Medical Director and Interim Executive Director, as well as Chief of Addiction Medicine for SummitStone Health Partners. And I cannot tell you how excited we are at SummitStone to embark upon this truly groundbreaking, innovative, and unprecedented approach to the delivery of behavioral health services in our Larimer County community. BHS will offer a robust continuum of care from mental health and addiction services, including a 24/7 behavioral health triage center, 2 levels of withdrawal management. We frequently refer to this level of care as detox, a CSU, or crisis stabilization unit, and an intensive residential treatment facility, or IRT, all under one roof. At SummitStone, we firmly believe that care begins with yes. Yes, we can serve you, and yes, you are welcome here. And this facility will be a place where anyone can come and feel comfortable seeking help when they or a loved one are in crisis. And they can feel good knowing that they will receive outstanding care that meets them wherever they are on the journey of recovery. That yes also extends to our community partners like law enforcement and emergency response. We've designed this facility in communication and collaboration with them because we understand that they are frequently called to the interface between public safety and mental health and addiction. We envision that BHS will also be a center of excellence for behavioral health care locally, regionally, and nationally. We see this new facility as a place where healthcare professionals can come to learn best practices in this collaborative effort to remove our work from constructed silos and bringing it to a deeper level of collaboration to serve the best interests of our communities. SummitStone could not be more honored to partner and collaborate with Larimer County and UC Health as we truly transform and evolve behavioral health care for the citizens of Northern Colorado from a series of isolated care sites into a truly functioning ecosystem that will serve our community now and endure for decades to come. Thank you so much.
Hello again. It is truly amazing to see how we are all coming together to provide such desperately needed services for our community, and how we are expanding what services are available. But again, this can only be made possible with your continued support. It is now with much excitement that we present to you an exclusive first glimpse into our newest residential treatment service and facility, Garcia House. To lead us on our tour today, I would like to turn it over to Cali Thole, SummitStone Director of Forensic Services.
Hi, welcome to Garcia House, a Circle program by SummitStone Health Partners. Garcia House is going to be one of 3 Circle programs in the state of Colorado. We are excited to bring this level of care to Northern Colorado, where currently individuals have to commit a crime in order to receive this level of treatment. Some general information about Garcia House and Circle programs in general. Circle programs provide co-occurring treatment for substance use disorders and mental illness. This level of care is considered medically monitored treatment, which means that we have 24/7 nursing staff on site. You will hear this referred to as ASAM 3.7 level of care. ASAM is the American Society of Addiction Medicine, and they create and provide best practices in substance use treatment. The program will serve 16 clients, both men and women. These clients will be served with evidence-based practices, including contingency management, motivational interviewing, trauma-informed care, as well as evidence-based group curricula. Each client will participate in 20+ hours of treatment a week. This will include individual therapy, group therapy, psychiatric care with a provider who is also knowledgeable in addiction medicine, medication management, including medication administration by our nursing staff, case management services, as well as peer support services. This level of care is provided to clients with the intention of stabilizing their substance use disorders. It is not intended to be long-term treatment. Because of this, part of the program is helping clients to transition to the next part of their journey in recovery. For many clients, this may include intensive outpatient services, or another level of residential treatment. Staff who are part of the Garcia House program will help clients transition to either services within SummitStone Health Partners or within their home community. As you will see, the building is still under construction. You are getting a sneak peek at where clients will receive this unique level of care. As an agency, we have invested in this project. We want the building to be warm and welcoming for clients. We want clients to believe that they can get well in this environment through trauma-informed care and culturally sensitive practices. In the building itself, you will see that most treatment services happen on the first floor. Within the first floor, you will find staff offices, therapy offices, group rooms, our living room or milieu, and kitchen area. This is one of our staff offices. This space will be used for clients to participate in individual therapy, case management, psychiatric services, and peer support services. Staff will utilize the space for meeting with clients, meeting with other treatment staff, and treatment planning. We have several different group spaces in the building. This includes a large group room, 2 medium-sized group rooms, and 2 smaller group rooms. The large group room is a big enough space that clients will be able to participate in curriculum-based groups, as well as big enough to allow for social distancing during COVID. The 2 medium-sized group rooms allow for a smaller space where clients can be in a more comfortable setting for group topics that are more sensitive in nature. The smallest of group rooms are actually provided for space for family therapy or individual therapy to meet individual client needs. As you can see, this is our kitchen, still under construction. In this area, clients and staff will prepare and clean up meals together. Clients will participate in cooking healthy meals as a part of learning about how nutrition impacts their recovery. The living area, which we also call the milieu, is a space where clients can relax in between their groups, work on some of their treatment homework, get to know their peers, and communicate with staff. Attached to that area is the nurses' station or milieu station, where staff and nurses can complete work, monitor clients, and also administer their medications. On the second floor of the building, you'll find another nurses' station, a smaller milieu, as well as 2 wings with sleeping rooms and bathrooms. This is one of our client rooms. You'll see 2 beds. We have 8 double occupancy rooms for the 16 clients that are here. They each have their own sleeping area as well as a desk where they can participate in doing treatment homework. There's also a bathroom in the space for the clients to share, as well as 2 closets. The milieu space will be really utilized for clients in the morning as they get ready for their day and in the evening as they're winding down, with staff available at the milieu station. Additionally, on the second floor, you'll find a laundry room because, again, clients will be expected to do their own laundry and will have access to this facility throughout their stay. The basement holds a workout area for clients. This area will be used for recreational therapy. There's exercise equipment as well as space for yoga or other therapeutic recreational activities. The staff of the Garcia House will be a multidisciplinary team made up of individuals who are therapists trained in both mental health and substance use disorders, a psychiatrist who is also trained in addiction medicine, nursing staff including RNs and LPNs, residential counselors or milieu management staff who are also trained in substance use disorders, as well as peer support staff. These staff will work together to individualize treatment for the residents of Garcia House. We will be opening Garcia House in the midst of COVID-19. This means that we are opening and taking special consideration to the safety of staff and clients. Clients entering the program will be screened for COVID and initially will be in a single room occupancy for the initial 14 days of their stay. Throughout their stay, clients and staff will be required to wear masks and will be encouraged to social distance throughout the program. We want to ensure the safety of both our staff and clients during this time. Additionally, because of COVID, we will be utilizing technology to help clients maintain connection with their family and social supports. This means that we will offer family therapy and family visits, as well as support visits through technology such as virtual visits. Thank you so much for joining me today. It was so nice to be able to show you Garcia House. We are very excited to open Garcia House and offer this level of care in our community.
Hello and welcome. I'm Karen Sanchez, a filmmaker and proud SummitStone board member. I have the honor of introducing you to a very special person, a valued friend and colleague, and a community advocate and leader. A member of the SummitStone Health Partners Board since 2013, Fred Garcia has brought such passion and dedication to the field of addiction treatment that he will now have a residential treatment center named after him. The Garcia House will continue the impressive legacy of a man whose personal commitment to improve the lives of those afflicted with addiction began with his training as a clinical social worker and has spanned 4 decades working in behavioral health. On a national level, he has served as deputy at the White House Office of the National Drug Control Policy, was appointed by Attorney General Janet Reno to serve as senior advisor for rural justice, and established policies for the National Drug Prevention Treatment and Intervention System. At a state level, he served as the chief clinical officer at the State of Washington's Division of Alcohol and Drug Abuse before returning to Colorado to continue his role as an advocate for substance use disorder treatment and immersing himself in the Northern Colorado community. Fred's strong sense of social justice has led him to advocate for more culturally appropriate services for people of color and to encourage more diverse engagement in local politics, co-founding Larimer Latinos and personally reaching out to the next generation of Latinos to bring them into the inner circle and mentor them. That's how I became a board member. Now it's time to hear from the man himself. It is my great honor to introduce you to Fred Garcia.
It's been a blessing for me to be in this field. I've had a marvelous career with many marvelous opportunities, serving as the chief clinical officer in 2 different state agencies for alcohol and substance abuse, and working at the White House Office of National Drug Control Policy. It's given me the opportunity to learn a lot about substance use disorders, and it's given me the opportunity to do what I can to move the field forward. I had the opportunity of working with researchers, some of the prominent researchers in the nation around the addictions, and I have had many wonderful mentors who guided me along the way. My first job out of graduate school was to work with a mental health center. At this mental health center, one of my first clients was a woman who was an alcoholic, and she wanted to get into recovery. And my experience of working with her and helping her get into residential treatment really intrigued me about the field of addictions. As I moved forward in my career, I learned more and more about this field, how much we have learned and how much farther we have to go. Many positive changes have happened over my 40-year career. I think one of the bigger ones is that the field is no longer looking at treatment of people who want to get into recovery with what I call the cookie cutter approach. The cookie cutter approach is the thinking that one size fits all. Everybody needs 30 days of outpatient and everybody needs some residential treatment. Now we have evolved as a field so that there's individual client planning, individual case planning for each individual who comes in, and that's a very positive thing. that has happened. Another very positive thing over the 40 years of my career is how graduate schools of social work have evolved. When I was in graduate school in the mid-70s, there was not a single class on the addictions. And now most of the graduate schools that I'm familiar with have a specialty in the addictions. And I think that is great. It's leading our field in a direction that we need to go. Another positive change that has happened over the years is medication-assisted therapies. There was resistance to medication-assisted treatment during the 70s and 80s because a lot of the practitioners had the philosophy that how can you treat drug addiction by other drugs? Thankfully, we have moved beyond that for the most part as a field. And I am pleased to say that SummitStone Health Partners is one of the leaders within the state in terms of implementing medication-assisted therapies. Another good thing that SummitStone is doing is that they've introduced medication-assisted therapies in the jails. So inmates who are getting ready to come back into the community, they can participate in medication-assisted therapies. This helps them get ready for their transition to the community, and it gives the community providers the opportunity for a warm handoff to continue treatment once this person leaves the institution. Another positive change besides medication-assisted therapies is the understanding of providers that both mental illness and addictions are brain diseases. It's not the addictions is not a weakness of the individual. It's not a character flaw. It's a brain disease. And a lot of providers now understand this. Unfortunately, a lot of don't. A lot do not. But I think people understanding that it's a brain disease is a very positive step moving forward. We as a field, I've seen evolution over the years that the full continuum of care is needed for a lot of clients. We need detox for people. We need intensive residential treatment. We need intensive outpatient treatment. We need aftercare. One of the positive things that SummitStone Health Partners is doing is developing the behavioral health services facility that will open, I think, in either late 2021 or 2022, that will provide this full continuum of care. And that's very exciting to see that developing within our county. We've made many, many positive changes. The field has evolved, but we still have a ways to go. Too many citizens, too many residents, too many of our population do not understand the stigma, or they continue to believe that it's a weakness of character, no willpower, and not understanding that it's a brain disease, and not understanding that a brain disease can be treated successfully. We need to understand that certain persons of color tend to need more treatment than the general population. And this is another passion of mine besides working with the addictions, is social justice. If I can make inroads for Latinos and blacks and Native Americans and all people of color to get more appropriate, culturally appropriate treatment, then I think I will be doing a service for our population. I have to say that this is a very personal issue for me as well. My niece, Jo Ellen, died last October from complications related to alcoholism. It happens in every family, and it happened in my family. Joey, as we called her, left 5 children behind. So it's not just an individual that was impacted by this. Her death, her disease impacted those children. It impacted the larger extended family. The addictions is something that causes a lot of pain to a lot of individuals and a lot of families. So it's a personal issue for me. It's not just a profession. This interview is about fundraising for SummitStone Health Partners, of which I'm on the board, and I've been on the board since the end of 2013. And I'm very pleased to have that opportunity. But the ask is to contribute to the program so we can continue to do more treatment, more education, more tackling of the stigma. I would like to share a story that my Native American grandmother used to tell me. And this story was of this tribe where they had an elder who was much respected and much revered by the tribe's people. Everybody looked to him for advice. He was considered to be very wise. And there was a warrior in this community, in this tribe, who was jealous of the elder, and he wanted to prove to all of his people that he was smarter than the elder. So he came up with this plan. His plan was to capture a bird. And in his hands, he held the bird, and in front of all the people, he was going to ask, is this bird alive or dead? And he specifically was going to ask the elder, is this bird alive or dead? The plan was, if the elder said the bird is dead, this young man would release the bird and the bird would fly away. If the elder, on the other hand, said the bird is alive, the warrior would crush the bird and let the bird fall to the ground. So the young warrior carried out his plan, and in front of all the people, he asked, "Elder, is this bird alive or dead?" And the elder responded by saying, "The answer to that question, my son, is that it's in your hands. Whether this fundraising opportunity is a success is in your hands." So I ask you to consider contributing to SummitStone Health Partners. To close out, I just need to say I am so humbled and so grateful that Garcia House is being named in my honor. It still almost brings me to tears when I think about it, because it is such an honor. And I want to say up front that I did not do a lot of things by myself. I stood on many shoulders, had many great mentors, and was pleased to be a team player. Thank you for this opportunity.
Thank you, Fred. What an amazing program, and what an amazing ally for behavioral health in our community. Now, I would like to introduce you to another of our greatest supporters and tremendous behavioral health ally, our current board chair, Karen Morgan. Karen has been a business professional in our community for over 30 years. She is president of the Fort Collins Foothills Rotary and serves as consumer advocate member of the steering committee for the Mental Health Substance Use Alliance of Larimer County. Karen is passionate about changing the dialogue and educating communities about the importance of a comprehensive and integrated approach to providing behavioral health treatment. She is a graduate of Colorado State University and has served on the SummitStone board since 2016 and was named chair in 2019. Please join me in welcoming Karen Morgan.
Thank you, Nathan. It's truly my honor to serve as chairwoman of the board for SummitStone Health Partners. I'm so proud of our passion and dedication to transform lives through recovery, renewal, and respect by providing unsurpassed behavioral health prevention, intervention, and treatment services in Larimer County for those diseases of addiction and mental health. Today, we have shared with you some of the exciting work in progress that has occurred or is underway to make a significant difference in the lives of our fellow Larimer County residents and families who are impacted by the disease of substance use disorder. Yet there's still so much more work to be done and progress to be made. While we are adding new services and capacity for treatment and recovery, it still will not meet either today or tomorrow's need. For example, despite the fact that effective treatments for opioid use disorder do exist, only about 1 in 4 people with this disorder received specialty treatment for illicit drug use in the past year. This treatment gap is not unique to opioid use disorder. Only about 12% of adults who need treatment for a substance use disorder receive any type of specialty treatment. Additionally, 45% of people with a substance use disorder also have a mental health disorder, yet only about half receive treatment for either disorder, and only a small minority receive treatment for both. Many factors contribute to this treatment gap. As Fred has reminded us, for far too long, too many in our country viewed and continue to view addiction as a moral failing rather than a disease. This stigma has made people with substance use disorders less likely to seek help. Other contributing factors include the inability to access or afford care, and a lack of screening for substance misuse and substance use disorders in general healthcare settings. 46% of Americans have a family member or close friend who is or has been addicted to drugs or alcohol, and they struggle with how to help or get help for their loved ones. That means either you, or if we were in a room together, the person sitting next to you or both of you have been impacted by addiction or substance use disorder. Addiction is a powerful disease. It knows no boundaries in terms of ethnicity, socioeconomics, gender, or any social or demographic attribute. Like me, many of you probably have your own powerful story to tell about how addiction has impacted your life either directly or you felt a sense of helplessness because someone close to you struggles with that disease. A dear, dear friend of mine lost her son to an overdose. He had struggled with addiction and substance use disorder for years and was working hard to recover, but a single relapse took his life. I wish this was a unique occurrence, but it's not. At least once a day, someone in Colorado loses a friend or family member due to drug abuse. This year, 25 people died of drug overdoses in Larimer County in 2019. While 28 Larimer County residents have died due to drug overdoses in the first 6 months of 2020. Only 21 have died in the county due to COVID-19 in the same period. If the number of fatal overdoses stays on current pace by the end of 2020, the fatality rate would more than double that of 2019. And how else has the pandemic impacted addiction and recovery? In the time following March 19th, 61.84% of surveyed counties experienced an increase in overdose submissions, with an observed 17% increase in suspected overdose submissions when comparing the weeks prior to and following the commencement of state-mandated stay-at-home orders. So as you can see, we have so much work to do for many of our fellow residents who need access to treatment and help to recover from this powerful disease. People can and do recover with treatment and support. That message and value is at the heart of all we do at SummitStone Health Partners. SummitStone Health Partners offers effective and evidence-based treatment services, but it's not enough. We can and want to do more to help our fellow residents who struggle with this disease. SummitStone needs your financial support and help to deliver that treatment to residents in Larimer County so they can recover from this powerful disease. Every dollar spent on treatment yields up to $12 in reduced costs for healthcare, workplace absenteeism, criminal justice, and community support services. There aren't many investments in today's world where we can say the return is $12 for every dollar invested. Your donations are invested in direct service to our clients. This event is our primary fundraising opportunity, and on behalf of our Board of Directors, we are asking for your financial support today and ask that you make a donation to SummitStone Health Partners to enable us to provide services to your friends, neighbors, and family members who have a substance use disorder. You had an opportunity to donate when you registered, and for those who have done so, we thank you. If you have not yet done so, please go to summitstonehealth.org/fundraiser and click on the green Donate Now button, or you can send a check to fundraiser SummitStone Health Partners, 56 Innovation Drive, Fort Collins, Colorado 80525. So let me get you started. Here is my check and donation to start to change minds and help expand the services available to treat addiction. I hope you'll join me and get involved for the well-being of our communities. Thank you for joining us today, and thank you for your generous support.
Thank you all again so much for joining us today. I hope that this has been an informative and enjoyable journey. Without your continued interest in our work, without your excitement and encouragement, and without your support, none of this would be possible. Stay safe, and thank you.
I'm Chris Otto, and I support SummitStone because no one should be alone or feel ashamed for taking care of themselves.
I support SummitStone because they have the vision to do what's right in these difficult times. They have the resources to make an impact on the challenges we face, and they offer quality care to those who need it most, including our loved ones. Please support SummitStone with me.
Hi, I'm Becky Draves. This is my son, John Draves. We support Spirit Crossing Clubhouse and SummitStone because it makes such a big difference in his life. I've been really impressed during the pandemic with the outreach, both by fellow clients and by staff, by phone, and a couple bringing a goodie bag. It helps him not miss Spirit Crossing quite so much.
I've been going to Spirit Crossing steady for 6 years. I've been affiliated and going for almost 14 years, say about 12 years. And SummitStone has been awesome, and the affiliation of the clubhouse and SummitStone is working well. And my experience of it is that SummitStone and Spirit Crossing are a positive influence on a lot of people's lives and makes a difference at both functioning and other facets of the mental health field. It's really a wonderful place to go, and it's helped me to understand myself and socialize and kind of understand the world better than I did before I started going. And it's a very helpful place, and I recommend it highly.
I support SummitStone because it sponsors Spirit Crossing Clubhouse, which tasks its members to something called work order days. Outcomes are tracked, just like the real world, but its members grow in maturity.
Hi, my name's Katie, and I am with My Big Day Marketing and Events. I support SummitStone because more visible this year than in those past is the importance of connection and the impacts that isolation can have on mental health and substance abuse. We all constantly rely on the support of friends, loved ones, and our communities to thrive. SummitStone provides that kind of support to those that need it most and to help foster a more resilient community.
My name is Joyce Devaney, and I support SummitStone because I'm passionate about individuals and families getting the care they need for mental health and substance abuse issues, and that's exactly what SummitStone does. In fact, to agree with Michael Allen, who said recently that the SummitStone staff were healthcare heroes, I couldn't agree more. They save lives every day, and we can't thank them enough. So thanks to SummitStone and thanks to the staff.
Hi, I'm Elena Serpolitis with Eon Office, and we're proud to support SummitStone Health Partners because we believe that good mental health care is as vital to our community as good physical health care.
I support SummitStone because of the fantastic people who are dedicated to its mission and the terrific work that it does in the community, helping those in need with mental health and behavioral health issues, as well as substance use disorders, and working with first responders and others to really try to make an impact and a difference in police response and individuals in crisis.
Hi, I'm Karen. I support SummitStone because it's so important to help people who have mental health and substance use disorder diseases. They deserve treatment like everybody else who struggles with a chronic disease in their life. I believe it's important, and I want to change and eliminate the stigma resulted to this disease, and that's why SummitStone is so important to our community.
I support SummitStone because I encourage a spread of mental health awareness and accessibility to care for all of those in need.
I support SummitStone because they have been an important partner of Housing Catalyst in providing supportive housing and helping us to house some of our community's most vulnerable residents.
I'm Nancy Tellez, and I support SummitStone because they care about and serve some highly significant needs of our community members, and they do so in very effective ways.
Hello, I'm Sandra DeSanti, and I'm here in Loveland at Art Space, and I just wanted to say that I support SummitStone because when I was in dire need of help, when I first arrived in Colorado, there were some wonderful people there who were great assistance to me, and I am presently seeing someone who prescribes the perfect combination of medication that I need for my chronic insomnia that I've had since I was 10 years old. Thanks, SummitStone.